Welcome to my final project presentation for Introduction to Artificial Intelligence. This is Maimuna Bashir. The topic for this presentation is heart failure prediction and machine learning approach. In this presentation, I will first define the problem, display some interesting findings found when exploring the data, following by explaining results in data processing, k-nearest neighbor, and decision tree, then proceeding to comparing between k-nearest neighbors, decision tree, and an extra experimental comparison with logistic regression, and finally ending with conclusion. Cardiovascular diseases have been the leading cause of death. According to the most recent World Health Organization data, chronic heart disease death in Egypt accounted for 29.38% of all deaths in 2018. Egypt is currently ranked 15th in the world. Early detection of cardiac diseases can reduce mortality rates, manage resources, and save money. People with cardiovascular diseases or who are at a high risk of cardiovascular risk due to the presence of one or more risk factors such as hypertension, diabetes, hyperlipidemia, or an already established disease need an early detection management wherein machine learning models can be of great help. To make sure my predictions are accurate, I will use the following machine learning algorithms. K-nearest neighbors classifier, as it is known for making highly accurate predictions. Decision tree classifier. It is the most widely used machine learning algorithm in healthcare. As for the experimental comparison, I will use logistic regression as is commonly used. This dataset has a total of 918 rows and 12 columns, which are age of the patient, gender of the patient, chest type, which are typical angina, atypical angina, non-anginal pain, and isometric. The next column is resting blood pressure, then cholesterol level, followed by fasting blood sugar level, resting electrodiagram result, maximum heart rate achieved, exercise-induced angina, old peak, which is ST depression, then peak exercise ST segments, and finally heart disease, such as 1 if the patient has heart disease and 0 if normal. As I was exploring the data, I drew a plot for each column in the data set and compared it with related columns. From the pie chart on the left, we can see that 55.3% of patients in the data set have some form of heart disease. The histogram on the right shows that most men have heart disease compared to women. Women are therefore less likely to have heart disease. From the histogram on the top left of the slide, we can see that the probability of having heart disease increase with age. Majority of patients aged between 50 to 60 years have heart failure. Moving on to the histogram on the top right, it shows that resting blood pressure for patients with heart disease. An ideal blood pressure is considered to be between 90 to 60 and 120 to 80. High blood pressure is considered to be 140 to 90 or higher. Lower blood pressure is considered to be 90 to 60 or lower. However, resting blood pressure for majority patients with heart disease in the dataset are between 120 and 140. As for this cardiac scatter plot below, it displays the maximum heart rate and age for patients with and without heart disease. Maximum heart rate is dependent on age. The equation is 220 minus the patient's age gives you the heart rate. From the scatter plot, we can see the majority of patients with heart disease are old and have a high maximum heart rate. As displayed in the following plot, there are some outliers in the data set, but I won't be removing all of them as they could be important. After all, this is medical data. There is a 0 value in the resting blood pressure, cholesterol, and old peak. It is impossible to have such values, so therefore I removed them. And the next topic is data processing. In this step, I checked if the data set contains any null values. The result was 0 for all the columns as shown in the image on the left. There are some categorical values in the data, so in order to convert them to numerical values, I encoded them as shown in the image on the top left. And finally, after dropping the target column heart disease from the data set, I scaled the data. It is important to do so when using k-nearest neighbor classifier. Not scaling will drastically reduce the performance. After splitting the data into train and test, I fitted the X train and Y train data into the classifier and made predictions on the X test data. As shown in the image on the left, the accuracy result is 0.84, which is good. Because I scaled the data, as shown in the plot on the right, the error rate became relatively low. The plot on the left shows the decision tree. As we can see, the root node is a column ST slope. Then it slowly descends into the remaining column. As shown in the image on the left, the accuracy result is 0.80, which is good. To compare between the predictions, I use confusion matrix. Results from k-nearest neighbors is as following: 96 correct positive predictions, 92 correct negative predictions, 15 wrong positive predictions, and 21 wrong negative predictions. As for the decision tree, it resulted in 93 correct positive predictions, 87 correct negative predictions, 18 wrong positive predictions, and finally 26 negative predictions, wrong negative predictions. Therefore, k-nearest neighbor resulted in the best performance. As for my experimental comparison, I use logistic regression, as it is commonly used for determining relationships between several factors and disease outcomes in healthcare. As shown in the image on the left, the accuracy score was 0.86. The confusion matrix on the left resulted in 100 correct positive predictions, 92 correct negative predictions, 15 wrong positive predictions, and 17 wrong negative predictions. The final comparison is between the two best results, k-nearest neighbor and logistic regression. As we can see, logistic regression has a higher correct positive prediction compared to k-nearest neighbor, and an equal correct negative prediction. Logistic regression has a lower wrong negative prediction and an equal wrong positive prediction compared to k-nearest neighbors. This means that the winner in this race is logistic regression. In conclusion, the accuracy result of k-nearest neighbor is 0.83. Decision tree is at 0.81, and finally, and which is the best, logistic regression with an accuracy rate of 0.5. Thank you for listening.